Hello everyone, my name is Dr. Ferox. We have Pancake, formerly known as Trash Bag, and Dingus down here. And I thought I'd talk to you a bit about pet euthanasia and what the process is supposed to look like. Because for you as the human, it's kind of going to suck either way. We try and minimize the suffering you're going to go through, but the grief is still going to hit you like a train. But from the pet's point of view, it's not supposed to suck at all. It's supposed to be a really kind of non-event. But if you're anxious about it, and fair enough, let's be honest, you might be searching for every single piece of information you can get to forewarn yourself so that you know what to expect. And if that's helpful for you, I can talk about it in lots of detail. So firstly, my condolences. I can't know exactly what you're going through. This is YouTube. I don't know when you're going to watch this video, but I know that it's going to be rough. Losing a pet is a unique type of grief, whether you've cared for them for a couple of days or whether you've cared for them for a couple of decades. It's compared to losing a best friend, and it's compared to losing a child. So it's a pretty heavy grief, and there's no shame in talking to a grief counsellor about it. We often say that grief is just love with nowhere to go. And in the context of pet euthanasia, we're choosing to suffer so that they don't have to. Because for the whole experience, we're going to be distraught. The pet is probably not really going to know what's going on. Sometimes they will know that you, the human, are upset, and they'll want to comfort you, but they don't know why. They don't really have that bigger picture. Now, I'm assuming that you've already spoken to family and your vet and whoever else is close around you that you need to come to the decision to euthanize your pet. I'm just going to talk about the process for now, because I'm assuming that if you're looking for this sort of video, you just want lots and lots of detail in order to prepare yourself for that day. The short version is that euthanasia solution is an anaesthetic overdose. In Australia, our solution is bright green. It's sometimes referred to as green dream, but overseas their solution might be pink or it might be blue. There was a brief period of time where there was a transparent euthanasia solution marketed, which was completely visually indistinguishable from saline, but it was not very popular because if you have a syringe full of euthanasia, you want absolutely no possibility of ever mixing that up with anything else. So it is a fairly bright and obvious colour. Anesthetics make pets fall asleep very quickly. So once it's actually given, it might be 10, 20, 30 seconds, and then they drift off into sleep. And then because it's an overdose, essentially, while they are asleep, they pass away. Typically, my preference is to place an intravenous catheter for this medication. Sometimes I will do that in front of the client, and sometimes I will take the pet out to the treatment room. This is because a catheter is a needle. It is a pointy metallic object, and there is often a drop or two of blood. And some clients cannot handle seeing that, and some clients just do not want to see that. It is the most clinical part of the whole procedure. And usually I will wrap it with a long line so that I can be distant from the pet to administer that solution, and I will wrap it in something colourful, just something that does not look like a hospital as such. I try and get the pet to lie on something comfortable or fluffy. Some pets have their own opinions about whether they want to lie on the bed you've made for them or not. And some pet owners want to actually hold or cradle their pet instead, and that's fine. As long as the catheter is in, I can do everything at the other end of the line. I can be a couple of feet away if I need to, mostly to give the pet owner a bit of sort of privacy, or at least to not be in their personal space so much. The euthanasia solution itself, being an anesthetic, means that the pet will fall asleep fairly quickly. That will include muscle relaxation, and their head drops as they lose consciousness, and everything goes sort of floppy. It might be another sort of 10, 30 seconds after that the heart actually stops. So if you want to be present while the pet is conscious, but leave the room before they are declared deceased, that's your window. Between when that head relaxes and goes down and when the heart is listened to, that's time to go, if that's when you want to go. Totally personal call. I will often delay listening to the heart just in case the owners don't want to hear the words, "their heart has stopped," because it makes no difference to the pet, it makes no difference to me, and sometimes it will make all the difference in the world to that pet owner. If you have a preference, try and let people know early. Once the heart has stopped, it's really normal for eyes to stay open. It's just a TV Hollywood cliche where the eyes close peacefully. On a real deceased mammal, human, pet, whatever it is, the eyes relax and so they open and the pupils dilate. They will often let go of their bladder or their bowel as well, but that won't be till maybe several minutes later, depending on how full they were. If you can, tuck a towel or something around there so the pet owner isn't watching, but if they're in their lap, at least you pre-warn them that that might happen. And sometimes they will puff up their fur, which is like a goosebumps reaction. Doesn't really mean anything. It's just a post-mortem reaction. And they will occasionally take agonal breaths, which is where they take a big gasp. So it looks a little bit distressing. They might do half a dozen of these, but it's just because the heart has stopped and the rest of the body has not caught up with the news. It just means that they're deceased. They're not consciously doing that at all. Being an anesthetic, there is a very brief window before they fall asleep where they sometimes feel kind of good. They get a bit lightheaded and they feel energetic, and that might last 2 or 3 seconds depending on how sick the animal was. The sicker animals are more likely to feel it. It's not them suddenly panicking or feeling regret or anything like that. They just felt a little bit good. Sometimes it's the equivalent of feeling high, except with an anesthetic, it's lasting very short, second or so, compared to something like heroin, which does the same thing. But heroin has a much longer high, which is why humans seek it out. And that's why an overdose can still result in death. It's the same sort of pattern. It's just ours is very fast to death without that excitement high phase persisting more than a second or two. And recreational drugs that humans seek out have a much longer high, and they are less likely, but still entirely capable of causing death. Now, before the euthanasia happens, I prefer to talk to that pet owner about all their options. That includes aftercare arrangements, whether they want to bury their pet or have it cremated, what sort of keepsakes they would like, whether that's collar or fur or paw prints or cremation vessels, who wants to be there, how long do they want to be there, and make it clear that this is all optional. There was a horrible post going around social media years ago guilt-tripping people who couldn't be present at their pet's euthanasia. And it's bollocks, and it was cruel. Sometimes people just can't be there. Either they're still overseas, or they're not going to drive back in time and the pet is suffering, or maybe that person has recently lost their parent or their spouse, or their child has recently died and they just cannot go through that again with a pet. Nobody should be there to judge people, and honestly the pets don't really know that much about it anyway. They know that the person is upset. Some of them are so sick that they don't actually seem to know whether you're in the room or not. And there is an option to sedate them so they know even less about what's going on. They don't really know that they are about to pass away. They just know what people are acting like. Now, sometimes I will sedate a pet before euthanasia, and sometimes I don't. This depends on the circumstances, so who is there, and the client's preference, but also on the health of that animal. Some animals are just so sick, they do not know what's happening one way or another. Like, some are so sick that the sedative would probably knock them off the perch, and that's not as controlled as the euthanasia itself. So I really do play it by ear, unless the client has a preference. There's a lot of things at the end of life that doesn't matter too much from a technical standpoint, but if the client has a preference, we try and honour it. Some of them aren't really equipped to talk about it at the time, but trying to talk about it days in advance is kind of helpful. It's still going to suck, but maybe that sucking will be less acute. Now, I do find it preferable to get all the paperwork and the talking out of the way beforehand, because afterwards, some people are not actually capable of speech. They are upset, and that is perfectly fine. If you've done all the paperwork beforehand, you do not need to hassle them essentially afterwards. They can stay in the room as long as they like. I find it best to give binary options, as in, do you want to stay with your pet for a while, or do you want me to take them away at this point? But if they are very upset, try and judge whether they are safe to drive yet. Some people are. They are going to go out and sit in the car, and they know when they're right to drive. Some people do not look right to drive. And if you can encourage them to have a breath of fresh air or a glass of water, or is there anybody they can call to pick them up, you try and look out for that person as well. We are not able to spot every type of grief, and some of them are very big grief. But if you think they're not safe to drive, do try and delay them a little bit. Now, some people want to bring in their other pets to see the euthanasia of the pet that needs to go. I don't really have a very strong opinion about this. I think having other pets present at the time can be distracting for people, and pets often know something is up, but they often don't react to the actual death the way people are expecting or hoping that they will. I think it's probably better to let them see the body afterwards, to have a sniff so that there's no unanswered questions in that pet's mind. Dogs more so than cats, but potentially both of them. They don't need to see it happen. Some of them will benefit from seeing what is left afterwards. And to that end, some people do prefer to take the body home for overnight, whether that's a spiritual reason or whether that is to let the other animals know what's happened. It's a totally personal call. Just be aware that if it's a very hot night, bodies will do what bodies do. So maybe you just want that for an hour or two. The other issue is children. Parents should have a decent idea about where their kids are at in terms of understanding death and what they want to witness or not. Very young kids often sort of know the words but not the concept as such, and seeing things is not going to do much either way. Older kids who understand the concept will react in different ways, but kids are also distracting to the parent. So if that parent needs to really be present with the pet and grieve, you need to decide whether having the kid in the room is helpful or going to make it worse. My belief as a parent is that older kids do benefit from having choice. Their experience is going to suck, and they may well go to therapy themselves as an adult. But a lot of kids who grow up to be animal lovers one way or another are very deeply impacted by the euthanasia of their first pet. And if they feel completely helpless, like there is no choice in it at all, because it's death, it is kind of like that. You don't have much choice at this point. If they feel there is no choice at all, it will affect them more severely than if they have literally any sort of choice. And the choices you can give them are being present or not, and what you do afterwards, whether that's burial or cremation or some sort of funeral at home, or making some sort of memorial, which might be a photo in a frame with stickers and fur. Just something that they can do, something that they can choose when they feel like all the other choices have been taken away. And it should be mentioned at some point that if you are taking a euthanized pet home, whether it's to bury or whether it's just to settle, that body is poisonous. The flesh and the bones are toxic if they get eaten. Now, it happens, particularly with dogs who like to dig up things that are buried. It's entirely possible for a pet to be poisoned eating the euthanized remains of a different pet. So do bear that in mind. Bury things deep, preferably with something fairly heavy on top. So my typical flow through for the euthanasia day is to talk about all the paperwork first and get that out of the way. Take the pet out to the treatment room or out the back and put an intravenous catheter into one of their legs. Maybe they are sedated, maybe not. It depends on the pet and on the family. Talk the people through what they are about to see, including the gasp that might happen, the eyes being open, and the letting go of the bladder and bowel. Then I give them time if they can, or if they need it. We actually euthanize the pet. And then it's just figuring out how much time do they want to spend with the deceased pet, or whether they're ready to start the aftercare arrangements. My name is Dr. Ferox. I'm sorry if you're going through all of this, whether it's your first time or your 50th time. If you have questions, I'm quite happy to make more videos on the topic. In fact, I do plan to over time. Or you can leave a comment below and maybe somebody else is going through what you're going through as well. Take care of yourselves and take care of everyone around you, whether they are furry or otherwise. And I will see you in the next video. Bye.